Hey, Jason Tuschman here with Spot on Patient Acquisition, episode 46. So as always, thank you for your time and attention. It's greatly appreciated. If you are enjoying these videos, please remember they're free, and all we ask in return is that you pass them on to somebody else that may find them interesting and can get value from them. We would greatly appreciate that. So today what we're here to talk about is measuring new and existing patients in your entire patient acquisition process and in your profit and loss statement, okay? New and existing patients should always be filtered separately when analyzing the performance of your business, either at a marketing level, at a patient acquisition level, and ultimately at a profit and loss level, okay? So here you can measure it by profit and loss in your P&L. What percentage of my revenue on a month-to-month basis or a year-to-year basis are new patients, or essentially people spending money with me for the first time? And what percentage of it is existing patients, okay? That mix of new patients versus existing patients should change over time as your business becomes more mature, and it's also a great indicator of your success as far as retaining patients and getting referrals. So it's a really important thing to measure, not just in profit and loss, okay, but also in your key performance indicators, as we've talked about before in other videos. You need to understand marketing's impact, okay, for new patients separately than existing patients. When you look at your lead to schedule rate or your schedule to attendance rate, and even your conversion rate of attended appointment or to a booked purchase, somebody that actually buys from you, those key performance indicators are going to be different between new and existing. New are going to be a little bit lower because they don't know you and you're acquiring them from marketing. Existing are going to be a little bit higher because they've already spent time with you. So that is going to make a difference in your analysis. So always filter it to make the best business decisions possible. So let's do a quick analysis on why this is really important, okay? So if you look at revenue, all right, and profit going up, and then the age of, or the types of customers, new to existing, coming out in years, okay? When you're a new practice, you're gonna have a larger percentage of your revenue growth coming from new customers. But as you get older, okay, and you get more existing customers, this is going to increase, okay? If your revenue continues to go up year after year during the initial stages of your practice, and your mix of existing patients is not increasing as a percentage of your overall revenue, you've got a patient retention marketing problem. It's great that your revenue is going up, okay, and it's going to be able to go up for a certain period of time, but ultimately you're going to exhaust the market, okay? So let's look at that. If you are sitting here and you're marketing and your revenue is going up, okay, in the initial stages of your practice, but it's only coming from new patients, okay, and you're not bringing these existing patients back, what's happening is you're going to flatline, okay, because your market can only support so much growth from new patients. So it's not that you won't continue to acquire new patients, but your growth rate will slow because the market only supports a certain amount of volume. And unless you have a high retention rate, you're not going to get the highest growth curve in your practice. So really make sure that your profit and loss statement, along with your marketing KPIs, are being measured on both new and existing patients. At the end of the day, that mix has a huge impact on your business and ultimately is going to impact your pocketbook accordingly. Hope this helps you. I look forward to seeing you next time.